Hey everyone, Dr. Mike here, but today I'm not dissecting medical mysteries. We're diving into the wild world of plastic surgery, the good, the bad, and the downright scary. We've all seen those picture-perfect transformations, but what happens when things go south? Get ready for a dose of reality as we uncover some jaw-dropping plastic surgery nightmares that will make you think twice about going under the knife. From botched Botox to facelift fiascos, we're about to witness the dark side of the beauty industry. Buckle up, because these before and after photos are not for the faint of heart. All right, let's talk about lip fillers. When done right, they can subtly enhance your natural beauty, giving you that perfect pout. But go overboard, and you risk ending up with the dreaded trout pout, or worse, the duck lips. Imagine going from wanting a little volume to looking like you got stung by a beehive. Not a good look. Sometimes these fillers migrate, leaving you with lumpy, uneven lips. It's crucial to remember that everyone's anatomy is different. What looks good on one person might look disastrous on another. That's why it's so important to have a consultation with a board-certified plastic surgeon who will assess your individual needs. Don't just go to the cheapest place or, heaven forbid, try to DIY it at home. The takeaway here is simple. When it comes to lip fillers, less is definitely more. Next up, we're delving into the world of facelifts, a popular cosmetic procedure that promises to rejuvenate your appearance. Now, a facelift can be a great way to turn back the clock, tightening up sagging skin and reducing wrinkles, giving you a more youthful look. But in the wrong hands, it can leave you looking, well, a little too refreshed, almost like a different person. Think wind tunnel effect, stretched out skin, and an unnaturally surprised expression that can be quite unsettling. One of the biggest risks with facelifts is ending up with that pulled too tight look, which can make natural facial expressions difficult. Another common issue is scarring, which can be a telltale sign of surgery. While most skilled surgeons can hide incisions along natural hairlines and creases, sometimes those scars can be quite noticeable and hard to conceal. And let's not forget about the potential for nerve damage, which can lead to facial paralysis or numbness, affecting your quality of life. So, what can you do to minimize the risks of a facelift gone wrong and ensure the best possible outcome? First and foremost, choose your surgeon wisely. This decision is crucial. Look for someone who is board certified, has extensive experience with facelifts, and understands facial anatomy like the back of their hand. This expertise can make all the difference in achieving a natural, refreshed look. The elusive nose job, or rhinoplasty as it's known in the medical world. It's one of the most popular plastic surgery procedures out there, and for good reason. The nose is the centerpiece of the face, and even a slight tweak can make a big difference in overall appearance. People often seek rhinoplasty to correct a bump, refine the tip, or even to fix a deviated septum. The results can be life-changing, boosting confidence and self-esteem. But when a nose job goes wrong, it can be a real nightmare. One of the most common complications with rhinoplasty is breathing problems. If the surgeon removes too much cartilage or reshapes the nasal passages too drastically, it can obstruct airflow. This can lead to chronic breathing issues, which can severely impact one's quality of life. Imagine struggling to breathe every day because of a cosmetic procedure gone awry. Another risk is a condition called saddle nose deformity, where the bridge of the nose collapses. This can give the nose a sunken appearance, which often requires additional surgery to correct. And then there's the dreaded overdone nose job, where the nose ends up looking pinched, unnatural, or disproportionate to the rest of the face. This can be particularly distressing as the nose is such a prominent feature. So how can you avoid becoming a nose job cautionary tale? Just like with any other plastic surgery procedure, choosing a qualified and experienced surgeon is key. Look for someone who specializes in rhinoplasty and has a proven track record of successful results. It's also important to have realistic expectations and to communicate clearly with your surgeon about your goals. Doing thorough research and seeking multiple consultations can help ensure you make the best decision for your face and your health. Cheek fillers, when done right, can restore youthful volume, create more defined cheekbones, and even improve facial symmetry. But go overboard, and you risk looking like a chipmunk storing nuts for the winter. One of the biggest problems with cheek fillers is that they can migrate. Instead of staying put where they were injected, those little gel-like substances can actually move around beneath the skin. Another issue is overfilling. Some people get addicted to the instant gratification of cheek fillers, constantly going back for more and more. But over time, this can stretch out the skin, making you look puffy and unnatural. And let's not forget about the potential for allergic reactions and infections. The key takeaway here is moderation. Start with a small amount of filler and see how your body reacts. Eyelid surgery, also known as blepharoplasty, can be a game changer when it comes to refreshing your appearance. it can remove excess skin and fat from the upper and lower eyelids, giving you a more youthful, alert, and well-rested look. But in the wrong hands, it can leave you looking permanently surprised, or worse, unable to fully close your eyes. One of the biggest risks associated with eyelid surgery is overcorrection. Removing too much skin or fat can result in a hollowed-out look, making you appear older and more gaunt. Another potential complication is ectropion, a condition where the lower eyelid turns outward, exposing the inner surface of the eyelid. To minimize the risks of eyelid surgery gone wrong, it's crucial to choose a board-certified plastic surgeon who specializes in eyelid surgery. Botox, the wrinkle-relaxing wonder drug that has taken the world by storm. When used correctly and sparingly, Botox can temporarily smooth out wrinkles, giving you a more refreshed and youthful appearance. But go overboard, and you risk ending up with that dreaded frozen face look. One of the biggest mistakes people make with Botox is getting too much, too often. Remember, Botox is a powerful neurotoxin that temporarily paralyzes muscles. Inject too much and you risk ending up with a face that's as expressive as a blank canvas. Another common mistake is going to an unqualified injector. Just because your friend's hairdresser's cousin's sister is offering Botox parties doesn't mean you should jump on that bandwagon. The key to avoiding Botox blunders is to start slow and low. Begin with a small dose and see how your body reacts. Breast augmentation, or getting implants as it's more commonly known, is a very personal decision. Some women choose to get implants to enhance their body image, while others opt for reconstruction after mastectomy. When done well, breast augmentation can be life-changing. But when it goes wrong, it can be a real nightmare, both physically and emotionally. One of the most common complications associated with breast augmentation is capsular contracture, which occurs when the scar tissue around the implant begins to tighten. Another potential issue is implant malposition, where the implant shifts out of place, resulting in breasts that look uneven, asymmetrical, or oddly shaped. To minimize the risks of breast augmentation complications, it's crucial to choose a board-certified plastic surgeon who specializes in breast surgery. Look for someone who has extensive experience with different implant types and placement techniques. The tummy tuck, or abdominoplasty as it's known in the medical world, is a popular procedure for both men and women who want to get rid of excess skin and fat from the abdominal area. It can be a great option for those who have lost a significant amount of weight or for women who have had multiple pregnancies. But like any surgery, it comes with its own set of risks and potential complications. One of the most common complications associated with tummy tucks is seroma formation, which occurs when fluid builds up under the skin. Another potential issue is infection. And then there's the risk of scarring. To minimize the risks of tummy tuck complications, it's crucial to choose a board-certified plastic surgeon who specializes in body contouring procedures. Hair loss can be a real blow to our self-esteem, and for many, a hair transplant seems like the holy grail of solutions. It promises to restore not just hair, but also confidence and a sense of normalcy. But just like any other surgical procedure, hair transplants come with their own set of risks and potential complications. It's important to be fully aware of these before making a decision. One of the most dreaded complications of hair transplant surgery is the doll's hair effect. This can be particularly distressing for patients who expected natural-looking results. This happens when the transplanted hair follicles are implanted at the wrong angle or density, resulting in hair that sticks straight up or looks unnatural and pluggy. Such outcomes can be quite disheartening. Another potential issue is poor graft survival. This means that the transplanted hair follicles fail to grow as expected, leading to patchy or incomplete coverage. Hair follicles are delicate little things, and sometimes, despite the surgeon's best efforts, they just don't take to their new home. This can be due to a variety of factors, including the patient's own biology. To minimize the risks of a hair transplant gone wrong, it's crucial to choose a qualified and experienced hair restoration surgeon. Research their credentials and ask for before and after photos of previous patients. Look for someone who specializes in hair transplantation and has a proven track record of successful results. A good surgeon will also provide a thorough consultation to discuss your specific needs and expectations. Liposuction, often touted as a quick fix for stubborn fat pockets, can indeed be effective in contouring the body. However, it's not a magic bullet for weight loss, and when performed poorly, it can leave you with more lumps and bumps than you started with. One of the biggest risks associated with liposuction is contour irregularities. If the surgeon isn't careful, they can remove too much fat from one area and not enough from another, resulting in a lumpy, uneven appearance. Another potential complication is asymmetry. Our bodies are naturally asymmetrical, and liposuction can sometimes exacerbate these differences. And let's not forget about the risk of skin necrosis, a rare but serious complication where the skin dies due to inadequate blood supply. The key takeaway here is to have realistic expectations and to choose your surgeon wisely. That's it for our plastic surgery nightmare roundup. Remember, going under the knife is a big decision, and it's crucial to do your research, choose your surgeon wisely, and have realistic expectations. If you enjoyed this video, give it a big thumbs up and subscribe to my channel for more informative and entertaining content. And don't forget to hit that notification bell so you never miss a beat. Now I want to hear from you. Which plastic surgery nightmare shocked you the most? Let me know in the comments below and let's keep the conversation going.